Welcome, everyone. I really appreciate you taking the time out of your busy day to attend today. I hope you will find the next 20 minutes or so to be informative and helpful. I am Dan Jackson, and I am the Chief Operating Officer at DenVantage. We are a company that offers membership plans for practices to offer to their patients. We currently have member practices in 17 states and are finding a very welcoming environment for this type of plan, especially once the ease of implementation and administration are clear and the benefits to the practice are considered. We will touch a bit more on that later in the presentation, but let's get right to things. So we all know that, and we experience it probably every hour of every workday, that dentistry is at a crossroads. Uh, Fee for service dentistry specifically, but overall the trends are not good. Corporate dentistry, as you know, is growing. The Aspen Dentals and Gentle Dentals of the world are growing and will likely continue to do so. Insurance companies continue to lower reimbursement rates while at the same time offering more PPO and closed shop plans. Insurance companies continue to advance their march towards dictating more and more treatment options and driving a wedge between the doctor and patients making the appropriate treatment decisions without having to hear the dreaded, "I can only do what my insurance covers" response. Overall, fee-for-service dentistry is struggling to hold on to the ground they gained over the years, and dentistry overall is suffering as. So on some level, we all know it to be true that your patients with insurance are your most expensive patients to treat. We all know that having a solid percentage of insured patients provides a degree of stability and dependability to your practice, so it ends up being a necessary evil of sorts. Your insured patients aren't all bad for your practice. They definitely have upsides. You do get a degree of loyalty from them, plus those regular deposits from insurance companies definitely help with cash flow. But at what cost? Are these insured payment patients actually making you money when you incorporate all the costs and the time and the overhead it takes to service them? Are they essentially break-even patients, or are you squeezing out minimal margins from them, but you know that even those margins are at risk given the direction of things? Either way, your insured patients are far from your ideal patients. Just to sign up for participation in these plans, you're giving a discount right away, and you're also assuming all of these additional costs. You don't need more insured patients. What you need to do is create more ideal patients. So this doesn't even deal with the almost half the population that doesn't have any dental insurance at all. This group either doesn't go to the dentist or they go only when they have an emergency situation. They're far from ideal on several levels. The percentage of uninsured that do go to the dentist on a regular basis are a real blessing and have the potential to be not just good patients for you, but the best possible patients overall. That's what I want to talk about for a bit. How this group can become ideal and how you can create more ideal patients. By taking back control of your practice, you can spend more time with patients, more time enjoying practicing dentistry again, and more time and energy thinking about how you can make your practice more valuable, and instead of how to hold on to the value you have already created before it deteriorates even more. Today, we are here to talk about the concept of doing just that by creating more ideal patients. So, what might an ideal patient look like, and how can you create more of them and then make that patient more loyal to your practice? Let's start by talking about what an ideal patient might look like. So, an ideal patient could certainly demonstrate a wide variety of behaviors, but today we're going to focus on those behaviors that most directly impact your practice's bottom line. Those behaviors that can reduce your costs and increase your profits. So for example, an ideal patient is one that you never have to print stuff and mail a bill to. An ideal patient is one that shows up for all their appointments. I know you all have some that do that now, but what if you could turn some of your worst in this area into some of your best? An ideal patient is one that if they had to miss an appointment on short notice, they would pay you for that missed appointment fee. So you wouldn't have that open spot that you got nothing out of. It's always preferred that they make the appointment, but if they can't, you would at least be assured of some revenue from that slot, and over time that does add up. An ideal patient would never have you file an insurance claim, never have you resubmitting or chasing down additional information due to a denial. An ideal patient would never have to deal with yearly maximums and waiting for an insurance company to weigh in to decide what treatment they will or will not accept. An ideal patient would also stay loyal to your practice and would tell family and friends about you. And then, of course, an ideal patient would also take personal responsibility for their own dental health and would stick to an agreed-upon hygiene plan because they know it is best for their overall health. So, if you do not have some sort of membership or loyalty plan in place currently, what percentage of your patients could currently be considered ideal? Is it 1%, 5%? Is it 10%? If you're like most practices, it is likely somewhere in between the 1 to 5% range at most. We'll talk in a moment about how membership plans can help increase that percentage exponentially, but for now, let's talk about what it would be like to have an entire practice full of ideal patients. If you had a practice full of ideal patients like that, you would be able to work directly with patients again and make decisions based on their best treatment options, not what their plan allows for treatment. You would get to set your own fees and your own discounts when you felt it was appropriate, not set fees with one eye looking at an insurance company reimbursement table. With a practice full of ideal patients, your admin team can focus on other aspects of running your practice, and you will be able to reduce your overall administrative costs significantly. Every day you would be advancing the practice towards your goals and towards you having more control over how your practice operates. And all the while, you are making it more enjoyable for your entire team while enhancing the overall value of your practice. So there's really no one solution that fits all scenarios in terms of creating a practice full of ideal patients. One thing for sure is that you definitely need to increase the number of patients who are not on PPO plans, and at the same time, make those patients more loyal and committed to your practice. Membership plans have proven to be an effective way to increase the percentage of getting uninsured patients to commit to your practice and to provide them with the incentives to do far more treatment than insured patients or uninsured patients that are not part of such a plan. A membership plan is a plan you offer to your uninsured patients that allows them to pay either a one-time annual payment or, more commonly, regular monthly payments in exchange for a defined list of covered treatments. Most commonly, the core treatments are preventative care services such as cleanings, routine x-rays, and an exam. Patients pay the practice each month whether they come in for treatment or not. The benefits of such plans are clear. Patients make a commitment to your practice by signing a contract that provides them with attractive benefits while providing the practice with a commitment to pay in advance, keep admin costs low, show up for their appointments, and make payments every month. There are several companies out there that provide assistance with getting a membership plan up and running. Only a few provide ongoing administration and full service to truly allow your practice to just focus on treating patients. So they're not all the same, and it's really important to understand that there are differences out there. It is the time and expense of setting up effective membership plans on your own is significant. It was estimated recently that in the first 18 months, it takes about $10,000 worth of resources, time, and expense to get a plan started from scratch. All the while, you're learning, you're making mistakes, you're correcting those mistakes, you're improving the plan. Versus a service such as what DenVantage offers, we've made those mistakes. We've corrected those issues, and we've got it figured out. So membership plans have evolved over the past 5 years to be easier to implement and administer for a practice when using a service that specializes in such plans versus doing it on your own. In today's market, most membership plan providers require that you buy or use their software, and or they require you to charge a predetermined amount for the defined plan benefits. You don't get to define the benefits, and you don't get to define the price of those benefits. DenVantage, at DenVantage, we have taken a completely different approach to this. So we are different. We're different in numerous ways. One is, the company was started by 4 active dentists who originally were only looking to create something for their own practices. The original intent was to develop a plan that would work within their 4 practices. They were not intending to have this be marketed elsewhere. They wanted to offer something to their uninsured patients that was a win-win for both the practice and the patients. They experimented for a few years and with different aspects of it, made changes, each tried different things out, and figured out the right combination of features so that it was both profitable for the practice and beneficial for the patients. It was very much on purpose. They did not want to have to buy or learn new software, and they did not want to have to train new employees on how to use that software every time there was a new person on board. They also wanted it to work easily with their existing practice management system. The result is that DenVantage works with all practice management systems and can be set up in less than 10 minutes. No changes. You don't need any tech savvy to figure it out. We've got this figured out already, and it's super easy. The biggest program requirement is that the dentist needed to have control over fees charged to patients. So when they originally started this out, it was they did not want to dictate pricing and charges to anybody. In our program, the dentist has 100% control over what the plan costs for his or her patients and any additional discounts he or she may choose to offer. No other membership plan does this. Nobody else can say that in the marketplace. We are the only ones that give you 100% control over pricing. So how does DenVantage work? Well, basically, we have 4 core plans. There's an adult preventative plan, a child's preventative plan, and 2 periodontal plans, one that has 3 visits a year and the other that has 4 visits a year. So essentially, the starting point is the plans include the benefits that you see on the screen. And it depends, the particulars depends on which plan they select. But typically, they start out this way, and then you have the ability to create your own plans and then price them accordingly. So you have the flexibility to do that, but we start everybody off with the 4 core plans. And you can adjust the services covered and set whatever price you feel is appropriate for these plans. So we have the core plan. You can make tweaks to that and price it accordingly. You can take something out and charge less, add something in and charge a little more. It's your call. And we have data that can help you regarding what others are charging and what their plans include, but ultimately you retain complete control over all pricing decisions. So patients sign up for a plan, and DenVantage manages the sign-up process. It's web-based, and we set them up for recurring billing on a monthly basis. A small percentage prefer annual billing, and we can do that as well, but most do go with the monthly billing option. And we handle all the recurring billing. We handle the payment issues associated with that. We keep you updated on what's going on, but we deal with resolving any issues, so this gets completely taken off your plate. We handle all the administration side. And we make sure everything's working as designed. Every month, we will then, we essentially, quote-unquote, bill the patient by making an automatic withdrawal from a checking account, if that's what they set up, or a charge to a credit or a debit card for the amount associated with whatever plan they selected. And it comes out from our automated payment processing, and we make sure it all works properly. If there's any issues, we deal with them. And then every month, we send you, your office, an electronic deposit into whatever bank account you ask us to send to that is the total of all net billings for that month. So anybody we collected a payment from in the previous month for your practice, we make one big deposit and we give you all the reporting showing all the different charges and all the people that were associated with that one deposit. So you get paid even on the months they're not seen in your office. If they never come in after their first cleaning, you still receive a payment for every month for the 12 months of their contract term. Every contract term is 12 months. It automatically renews if they do not cancel, and you will receive a payment for every one of those 12 months, whether they're seen or not. So we also believe that it's really important that patients are not just given discounts, but rather that they earn their program benefits, which could include discounts on non-preventative care services, but that's your call, that's your choice, but they have to earn that. As such, all patients are required to sign a contract stating that in order to stay as an active member of the plan, they agree to do their part to help the practice keep their costs down. So that includes paying for all treatment in advance. They also agree that if they miss or cancel an appointment on short notice, they agree to a missed appointment fee of which you set the price of that. We can advise you on what others are doing, but you have the freedom to set that fee. They also agree that they will not ask or require the practice to file any claim forms or deal with any billing statements and other administrative tasks that take time and add expense to having them as a patient. In exchange, they get the opportunity to pay for their preventative care treatment on a month-to-month basis and receive any discounts which you set on non-preventative care treatment. So we have now seen the results and impact DenVantage has had on many practices. The DenVantage partner practices have been doing this for close to 5 years now, and we have been offering it to other practices for about 18 months, and we already have participating practices in 17 states, and the results are pretty clear. We're seeing much better numbers with the DenVantage patients regarding keeping their appointments, partly because there is this missed appointment fee that they incur, but also because at the day of the appointment, if it's a cleaning, there's nothing out of pocket. They're not having that choice on Wednesday about their Thursday appointment if they're going to pay the electric bill or they're going to go get their cleaning that week, and because they're not paid till Friday. They don't have that. That's taken off the table. This becomes part of the background of their monthly bills, so they don't think of it nearly as much as they might otherwise. So the biggest piece that we have noticed is that, and it was quite a surprise, is the case acceptance numbers. Patients are far more likely to want to hear what the ideal treatment plan is and are more likely to do that plan as they receive a discount as a member of DenVantage to do those non-preventative care services. And again, you set the discount. We can advise you. We think most plans and most dentists give way too much in discounts, and we have data that shows what the sweet spot is for what that discount should be, and it's far lower than what you might imagine. But these numbers you're seeing on the screen, they are real and they add up. Now imagine if just 10% of your patients were on DenVantage. What about 20%? We have partner practices where that's exactly what's happening. So what impact will DenVantage have on your practice? Well, we know now from years of data that DenVantage patients are as close to ideal as they come. They make a profound impact on your practice and on your bottom line. We are just starting to roll out a new offering that is targeting small businesses. It's called DenVantage Small Business. I know, creative name. And it's designed to allow companies that can't afford dental insurance in a traditional sense to offer DenVantage instead at a savings to the company over traditional insurance that is significant. The benefit to your practice is that you would now have new patients coming to you as employees will need to select a dentist from the list of local DenVantage member practices. So getting started with DenVantage isn't the only step you can take to start building a practice full of ideal patients, but it is one of the most impactful. It is one of the fastest and truly one of the easiest ways to start down the road of creating more ideal patients. So I know some of you have probably seen what we call the explainer video speaking to dentists about DenVantage. We also have one that's targeted at patients, and I wanted to end today with showing you that. A lot of practices use this on their websites or Facebook pages and other marketing, but we wanted you to see something that could run out of loop in your waiting room or be something they can access via your Facebook page. Let's take a look.
Are you among the 1 in 2 Americans with no dental insurance? Is that causing you to procrastinate your dental care, even though your health, your comfort, your confidence, or even your ability to chew may be slipping away? Well, we have good news for you. Having no dental insurance doesn't have to be a problem anymore. In fact, you can have something that's better than insurance. It's uninsurance. What's that? It's called DenVantage. It's a plan for... Are you among the 1 in 2 Americans with no dental insurance? Is that causing you to procrastinate your dental care, even though your health, your comfort, your confidence, or even your ability to chew may be slipping away? Well, we have good news for you. Having no dental insurance doesn't have to be a problem anymore. In fact, you can have something that's better than insurance. It's uninsurance. What's that? It's called DenVantage. It's a plan for anyone without insurance. For a low monthly membership fee, you can have all your regular preventative visits at no...
So once again, I want to thank you for taking the time to listen and learn more about DenVantage and how you can start the process of creating more ideal patients and at the same time fundamentally change your practice in the process. Again, my name is Dan Jackson, and I hope we can continue the conversation. Thanks.